Canadian Centre of Substance Abuse. As you may well know, Surrey has been hard by the opioid crisis, along with other areas in British Columbia and Alberta, particularly by fentanyl-laced recreational drugs. My colleague Sue Dhaliwal held an emergency summit with health professionals who work with individuals on the street that have substance abuse issues. Through these dialogues, I've heard conflicting conclusions as to whether or not opioid prescriptions should be reduced. I'm curious if you can disclose what your research indicates on this matter. So some have stated that the prescription should not stop, that some of the opioid-based prescriptions are helpful in reducing addictions, and otherwise the alternative is fentanyl-laced drugs. And others have said that the prescription-based opioid use is very high. What's your opinion on that?
I think I do want to stress one thing, that when we first did First Do No Harm, there was an impression that there was one solution to the issue. And I think, as all of us have said, there is no one magic bullet, no one solution. I think we do need to address prescriber education. I think we need to look at ensuring that clinical practice guidelines are being utilized in the physician's offices by primary care professionals. At the same time, we also need to look at diversion. And we need to ensure, first of all, that the physicians are complying with those guidelines. And we do have evidence that indicates as to what those guidelines ought to be, and where do the physicians that are prescribing we need to look at then what physicians are prescribing higher than those guidelines. And when I mentioned prescription monitoring programs, I was referring to that. As to the diversion, there is a lot of diversion right now, and I think that was mentioned, and we're seeing that. So it isn't one answer to the problem. It is, we have to look at both.